Hey guys, thanks for clicking on this video. If we've not met before, my name's Danny. I am on my journey to becoming a doctor and I currently work in the NHS as a healthcare assistant. I've worked in the NHS for over a year now. I've also done agency shifts during that time. I've worked from frailty all the way to accident and emergency, and this includes throughout the coronavirus pandemic. Now, I realised when I was starting out that there's not too much help online for healthcare assistants to the extent that there is with nurses and doctors. So I thought I would make some videos to help you guys out, as I know that you might be needing them. I'm going to be talking about what actually is a healthcare assistant and answer some important questions around that topic. Having achieved a first-class biomedical science degree, I like to think have an attention to detail and having a good broad range of experience using the agency. I think I'm well equipped to talk on this topic. I hope to share with you guys what I learnt when I first started out and over my year of experience in the job. Whether you are looking to apply for the job or you are newly starting, this video will be great for you. So make sure you watch to the end for the best tips. A healthcare assistant is an individual that works closely with a team of nurses and doctors to provide patient care. This can range quite drastically depending on whether you are working in the NHS hospitals, a general practice or a care home. In a care home, your main responsibilities will be to help patients with their mobility, whether this be getting in and out of bed in the mornings and in the evenings, helping at tea time with everyone that needs help with feeding, as well as the toiletry and hygiene needs. And you will also be required to make beds as well. This usually again is in the morning or in the evening. However, when you go to the NHS side of things, it becomes much more clinically focused. So depending on what your interest is, you may think that the care home might be better for you if you're not too interested in the clinical patient pathway. Working in an NHS hospital, you will be much more involved in the patient's clinical pathway. You'll be required to do everything we've just talked about, as well as record observations for the patient's vital signs such as oxygen saturation, blood pressure, temperature, and others. In certain wards that are a little bit more acute, such as acute stroke, you may be required to perform ECGs, bladder scans, and blood sugar levels. In the hyperacute settings such as accident and emergency, you'll be required to take blood samples and possibly to insert cannulas with the requisite training. In a GP surgery, you'll be doing mostly routine clinical checkups, taking bloods when necessary, and restocking the clinical room. Now, although these three roles do vary a lot, you are very hands-on and get lots of patient contact. So how do you become a HCA? Well, there is a couple of ways that you can apply for the job. You can go through the NHS jobs website, which is the main entry, or you can apply like I did, where I rang the hospital that I wanted to work for and I said to them, how do I get this job? And they told me that they hold applicant days where they invite people to these days. You take a quick maths and a simple English test, nothing too over the top, and then they ask you a couple of questions about what you would do in certain situations if you was in the role. Anyone can apply for this job because there is no qualifications required other than to be proficient at speaking English, because obviously you'll be speaking with the English public every day. With regards to the interview, it does help to have previous care experience, but don't worry if you don't have it, because it's not essential, it's just desirable. And Even if you've not had direct care experience, if you've looked after a family member, for example, I know one of my friends used the example looking after their nan because they had never worked in care before, but they'd cared after their nan, and so they had understood the empathy involved in looking after somebody that's in a vulnerable situation. There is lots of different types of people that can become HCAs. I work with such a diverse group of people. I work from boys that are 20 years old like myself, to 50-year-old Indian ladies, to middle-aged Filipino women. Such a variety in this job, and it's one of the reasons that makes it so special. And that's why when anyone asks me should they apply for a HCA job, I always say yes. It doesn't matter your age or your background. What matters is that you carry a few of the traits, such as being a good communicator and being empathetic, and that is all you need to start to learn how to be a HCA. So what training do you get to become a HCA in the NHS? Well, when you start, you'll have a weeks long induction training. In that training you go through all of the paperwork that you need to complete before starting. This includes to sort out your NHS card, which is vital to access all the systems. This stuff is mostly general about policies that the hospital has. On the second week, when you start on your ward or wards, you will do on-the-job training. Usually you follow another HCA round for a while until you're comfortable to work under your own initiative, and once you are, then you can start to work on your competencies, such as taking blood sugar. These competencies you will have to do a little bit of online work for them as well. Another bit of training that the NHS puts you through is the NHS Care Certificate. So this is a booklet that will become a qualification, and you can take this to anywhere else that you want to go work as a healthcare assistant, and it will be recognised. It is designed so that everyone has the safe minimum level of understanding to carry out the role safely. Is there opportunity to study further? Yes, there's definitely opportunity to carry on your professional development. I see a lot of people that have worked as HCA for quite a few years and go on to be a band 4, which is like a nursing associate. So these individuals do basically everything that a nurse does, except from they can't give out the medication. Or if you want to, you can go down the route of studying to become a registered and qualified nurse. I've seen a few people do this as well. The NHS is great for supporting you through this process. They will also help you with time off when and as you need it to study. And if you're like me and you've graduated from university with a degree, it has to be at least a 2:1 or above, then you can use being a HCA to bolster a application to study medicine and to become a doctor. Now, I'll talk about this more in depth in another video if that's what you're interested in, but it does open up a few more unis that you can apply to if you have over a year's experience in the NHS, and almost every university wants you to have some sort of experience in healthcare, working in healthcare, and full-time is even better. So, what do I love about the job? Well, one of my favourite things is that I come to work every day and I work with lots of professionals that are absolutely excellent at their job and really care about their work and the impact that their work has on the patients that they're seeing, and that's quite aspirational for me. It definitely makes the job a lot more fun, and makes you feel a little bit more comfortable because there's a lot of people around to help. Not only this, I would definitely say that the bond that you build sometimes between patients, being with an individual and helping them get through possibly the most vulnerable moment of their life is an experience that is so rewarding that you can't really put into words, and until you've been in the situation, I don't think you can fully understand. But I know that a lot of healthcare workers out there will definitely stand with me when I say that it does drive us to go through some of the worst shifts that we have. And because I work in a hospital, my least favourite part of the job is dealing with patients' feces. You know, sometimes, especially if they've infected with C. diff, then their feces can really stink. And if you can't hack that, then maybe don't apply to be a HCA in a hospital, because you probably will deal with this on a daily basis. So if you're interested in being a HCA but can't really deal with this side of the job, for example, if you're not comfortable with washing someone's bottom, then I would definitely say that apply for a general practice place. And secondly, sometimes we have to do some mundane tasks such as filling out routine paperwork, but this is something that needs to be done and also covers your back in the court of law. So a very popular question is what hours do you work and how much do you get paid for working those hours? Currently I work in a hospital and I work 38 hours a week. This boils down to 3 long days. This is working from 7:30 in the morning till 8 p.m. or 8 p.m. till 7:30 in the morning, so about 12.5-hour shifts. And that half an hour overlap is so that we can tell the staff that are just coming on to duty about our patients to make sure that they're safe to look after those patients. In the hospitals, NHS pays roughly about £9 an hour for a standard HCA without further training such as phlebotomy, and on Saturdays and nights this is bumped up to 1.4 times the £9 hourly rate, and on a Sunday you are paid double. So depending on when your shifts are or when you request shifts, will depend on how much you're paid at the end of the month. And if you want more hours, you can always join an agency. NHS Professionals is a very good agency to join. You can join it, I think, a month or two after you've joined the trusts, and it's a good way to do a few extra shifts here and there if you're looking to, I don't know, buy a car, or for me, save up for uni expenses. However, if you're working in a general practice, then often the work is about 8 till 5, and this is because the general practice is normally open 9 till 5 anyway. I'd just like to say that I've absolutely loved being a HCA, and it is honestly one of the best jobs I've ever had in my life. It's helped me so much as a person, even through this crazy pandemic time that we're going through, which has made the job a little bit more stressful because we're wearing the full PPE, and I've just thoroughly enjoyed 90% of my time at work. And I've met some really incredible people, and the bond that you have with your colleagues inside the NHS is something that I've never seen in other places at work. So if this is something that you're looking for, I definitely recommend applying to a hospital. So thanks for watching, guys. If this video has helped you in any way, please click the like and subscribe button to get notifications when I release more content. If you want to know more about being a healthcare assistant, or you want to know how to go from being a healthcare assistant to medicine, then stay tuned because I've got more content coming your way. Thanks for watching, guys, and peace. You sit down.